New president of the American Heart Association is sounding the alarm in the fight against heart disease and increased risks for COVID-19 complications. She's stressing the urgency of getting vaccinated. Here's Latrice Curry with Eye on Health.
As a cardiologist, Dr. Michelle Albert brings a passion with her to the fight against heart disease, the #1 killer of both men and women. As head of the American Heart Association, she's sounding the alarm about cardiovascular disease and COVID-19 complications, hoping to change those grim statistics all across the country, one community at a time.
Treating and taking care of what I would call vulnerable communities. And vulnerable communities include communities and people who are economically deprived and who belong to groups who have been discriminated against, historically speaking.
In the midst of the pandemic, Dr. Albert finds herself not only focusing on heart disease, but also encouraging those with heart disease or risk factors to get their COVID-19 shots.
Getting COVID-19 vaccine is your best bet against dying from COVID and having complications from COVID and protecting public health as well as your loved ones.
As Dr. Albert reaches out across the country, she knows here in the Southeast, the challenge is even greater.
For example, like where in the stroke belt, where you are, where the risk of having a stroke is much higher, risk of having a heart disease much higher.
Dr. Albert says that's because of our lifestyle choices, which often includes diets filled with fried and processed foods, a lack of physical activity, and more people smoke. And those people could face a more difficult fight if they contract the coronavirus.
We are at higher risk of having complications from COVID if you have a history of cardiovascular disease, hypertension. Obesity is one of the biggest risk factors for complications related to COVID.
But with all the misinformation circulating, convincing some in the most at-risk communities to get vaccinated is not easy.
We started sounding the alarm. We put out webinars. We put out information about the science behind COVID and the COVID vaccine once the COVID vaccine got developed.
And Dr. Albert's stress is always turning to trusted sources for information.
Empower yourself to become educated. Reach out to organizations like the American Heart Association.
That was Latrice Curry reporting. And the doctor says the vaccine is safe for pregnant women and can protect them and their babies from high risks of complications from the virus.